I have Dr. Michelle Roughton here from Amelia Aesthetics to help answer some questions that breast reduction as well as lift patients often ask in the Bustmob community about nerve damage. You know, there's a little bit of additional cutting compared to an augmentation. So how does that increase my risk for nerve damage, or does it?
So like many risks, this is a hard risk to track because not everybody will come back and tell me. Other people will. Most of the time, nerve symptoms after surgery go away in enough time. I actually thought I was one of the patients, super rare, 1 in 1,000 or so, that had a permanently numb spot after my implants went in. And 2 years later, I was like, no, it's on. And I didn't have a numb spot anymore. So it does tend to get better. What I tell patients is, early on, it's really common for you to either have hypersensitive nipples or skin, almost like for me, like when I was breastfeeding and I was like, don't touch anything. Or to be kind of numb, usually not totally numb. Like you'll feel deep sensation, but not superficial. And then depending upon what has happened, whether the tissues are just swollen or stretched or cut or trapped in scar, it takes a different amount of time for that nerve to recover. So back to your original question, how does it affect your risk? Well, gosh, the most risky thing would be to have a mastectomy if you had breast cancer. You have a mastectomy, you're almost certainly going to be numb because everything has to go, right, to cure the cancer. When you have a large breast reduction, and large is, again, a gray word, the more we take away from the breast, the higher the risk is that you'll have changes in sensation to the nipple because we're, by definition, taking some away and leaving some behind. When we do a breast lift, we're generally not taking very much away at all. So now your risk is coming down even more. And then as you mentioned in the beginning, when we put an implant in, yes, we have to surgically alter that area, but we're not dividing any skin around the nipple generally. So the less skin you divide, the less skin you cut, the less breast you take away, the lower your risk is. And then time is our friend in this case. So time and then desensitization, which is kind of strange. Time to let nerves kind of come back to life. And then desensitization, if you have like an extra sensitive spot, shockingly, touching that, massaging that area, watching yourself touch that area in the mirror, which sounds even more ridiculous, but does work. Those desensitization exercises can really make all of the difference. And it's not that you shouldn't have surgery, but I think like many things, it's one of those things you have to know is possible so you can be prepared to handle it after surgery. If my patients are having pain or numbness, I always want them to come in or reach out and let us know, because often we can at least make you feel better about it, if not intervene.
Absolutely. We do not want this as a surprise. So that's our point in educating people. So thank you very much.
You're welcome.
If you're researching plastic surgery, you're going to want to hear this.
The video you just watched was one of hundreds of educational plastic surgery videos that you can find in the completely free Bustmob Academy app. Go download it in the App Store.
That's right. And that's not the only free resource. We have tons of them that the team at Amelia Aesthetics has built with you in mind.
Yep, so you ready to start researching? Watch this video right here to learn about all of the benefits and resources available to you in the Bustmob community.